everyone, hope you're well. My talk today is Delegating Nursing Care, and this is aimed at newly registered nurses and nursing associates or student nurses who are starting to take caseloads of patients and are having to delegate and prioritise care to support workers. And this is a skill that is developed over time, so I've got lots of tips for you in this session. And I know that delegating and prioritising care can feel quite overwhelming when you first start to do it. And so I'm going to discuss some key tips to help you. And some of the key questions that I'm often asked are: who can I delegate to? What can I delegate? How do I develop my delegation skills? How do I delegate and prioritise patients' needs when we are so busy? So that's sometimes a newly registered nurse or nursing associate who has a ward full of patients and they now have 8 patients to look after instead of maybe 3 or 4 that they had when they were a student nurse or a trainee nursing associate. And it's a skill that you develop over time, and as I said, I'll give you a few tips. Or I'm struggling to delegate and manage my time, so somebody that started a role, newly registered nurse or nursing associate, and what do I do if I'm struggling? So I'll go through some tips. Don't forget to subscribe to my YouTube channel if you want any more videos like this. It's free to subscribe, and I've got lots more videos coming out in the future on nurses' career development, and I really hope they help any of you out there. So keeping it really simple, there are 3 essential elements of delegation for nurses. The first one is to make sure the person understands the instruction or the task that you've given them, and that you've given really clear instructions that might include a timeline. So, for example, if you ask a support worker to take a patient to the shop in a wheelchair, that they come back at a certain time, or that they do observations within a certain time. Make sure the person feels adequately supported. So you don't just delegate to somebody and leave them. It may be that you have to go back, check that they're okay. Are you okay with what I've given you? You know, if you haven't heard back from them when you've delegated to them for a little while. But making sure that they feel supported, and you get to develop your relationship with your support workers that you'll be delegating to. And when you first start, that's what newly registered nurses and nursing associates probably find the hardest, that often they'll come to me and say, oh, I did it myself because I wasn't sure. I need to know it was done. I need to know, you know, that they've done it properly. And I'll talk a little bit later about making sure that you look at the evidence of what competencies or proficiencies that the support workers have achieved. And as you develop your relationship with support workers, you'll get to trust them and understand the competencies that they've achieved and what they can, what you can delegate to them essentially. And the third thing, which is one of the most important, always confirm the outcome of the task or intervention that you've delegated. So an example might be you're on a night shift and you've delegated, you've had a new admission in, and you've delegated a healthcare assistant to do observations, and they're competent to do those observations. They've had the sign off to be able to do that task. You've gone and asked them to do the observations, and you didn't get them to tell you what they were, and they forget, so they don't come back and tell you. And those observations are a 39 degrees centigrade temperature, they're tachycardic with a pulse of 150 and hypertensive, 60/40 blood pressure, and generally very poorly. But that healthcare assistant has forgotten to come back and tell you. Ultimately, you are accountable for escalation and for those observations, which should be going in your electronic patient records and your documentation. And so you've got to it's your responsibility that if that healthcare assistant forgets to tell you, that you go back and you ask, what were those observations? Otherwise, at 6 o'clock in the morning, you may go to your patient and they're in septic shock. And ultimately, you are accountable as the registered nurse. You delegated that task, but part of delegation is confirming the outcome of that task. So who can I delegate to and what can I delegate? So you've got a duty of care and a legal responsibility when you delegate. For example, the example that I just gave you in relation to checking up on the observations. And you must ensure that the activities that you've delegated were delegated appropriately. And you should only delegate within the person's scope of competence. So when you start in a role as a newly registered nurse or a nursing associate, it's really important to look at your support worker roles. They might be called health and social care support workers. You might work in the community or in a hospital. They might be called nursing assistants. But what support worker roles do you have in your team? What are the names? And what training and development have they had? Now, we don't have a national standardisation that's mandatory for all health and social care support workers. So, for example, your nursing associates and your registered nurses are registered with your Nursing Midwifery Council, and support workers currently are not. So some of them may have completed a care certificate or health and social care level 3 courses or 4 courses or apprenticeship level 3 courses, but so they can all have different levels of training depending on where they work, and locally it can be different. So when you first start, my key tip is to ask the managers what the names of the roles are and go and talk to your support workers to find out what levels of competence they have. When you delegate, the support worker must have been trained to perform that task. So if they have not been signed off to do a blood pressure, they cannot do a blood pressure for you. Even if they are a senior band 3 nursing assistant, they may not have had the training to do a blood pressure. It depends locally on the job description. So you need to look at the evidence of competence on their assessment, and you'll learn about that when you go into an area. You can find out who's had those assessments by talking to your experienced nurses and your senior nurses. I've got a helpful video, YouTube video, on the difference between a support worker, an assistant practitioner, a nursing associate and a registered nurse when you're looking at delegation. So you can look at some of the training and the standards according to their training and their development, and it sort of gives you an overview of some of the education that support workers may have. So you might find that video helpful. So when you're looking at who you can delegate to, use your orientation period to find out about support worker roles, but also allied health professional roles. We have apprenticeship level physios and OTs, for example, and assistant practitioners that are physios and OTs, or speech and language therapists. So senior nurses should introduce you to those teams, and it's helpful to review medical and allied health professional roles and team structures, because you may delegate an aspect of work to another professional even. And look at when teams meet, what is the role of each member and the aim of those meetings. That's a great way to find out about the roles in your area, especially during your supernumerary orientation periods and during your initial inductions. One key tip is don't be hard on yourself. It takes time to develop your skills through experience and through reflecting, and it cannot all be learned overnight or in a classroom. So it takes time. Not everything will go to plan. I made many mistakes when I was delegating, and you cannot achieve perfection all the time. And you may have a reality shock, so you have an increased nurse-patient ratio from when you were a student, so that you're accountable for, and that can take a while to get used to. So make sure you reflect with experienced nurses. Don't be hard on yourself, and it's normal to feel nervous when you take patient caseloads and you're looking at developing those skills. Delegation skills are acquired through experience and through the support of others. So observing good role models. So as students, watch what your those role models, those nurses that you see delegating, and ask them questions. You know, can you give me some tips for delegation for when I'm registered? How do you delegate when you have lots of buzzers going on a ward, for example, or you have you've just had handover in the community? How are they prioritising their care? And receiving constructive feedback on your practice is the best way to learn. So you delegate either alongside somebody, you're shadowing, and you should have somebody to work alongside you when you first start. But once you have your own caseload, ask people. If you're struggling, make sure you talk to people and reflect, and that will inform your future skill development. Remember, preceptorship, where you're allocated training and development, includes direct supervision to develop your skills. And everybody has different skills. When you've got different strengths and weaknesses. And some newly registered nurses and nursing associates find it easier to prioritise and delegate and manage their time than others. Some find it harder, and utilise the support. So when you first start, or when you're looking for jobs even, find out what they will offer relating to constructive feedback on your practice. And there's national projects currently focusing on newly registered nurses transition. So there's going to be a lot of work being done in this area, but be proactive and ask for more direct supervision to develop those skills if you are struggling. Access support in the clinical setting. So ask clinical educators, practice supervision from experienced nurses. You may have local induction and training, preceptorship programs. They might have action learning sets. You can have, talk to other newly registered nurses about how they're finding it, and that will make you feel better, because talking to other people puts issues in context and you're not alone. And also you might have some band 5 competencies to achieve, and that's where you will have some structured reflection with preceptor or an experienced nurse. Developing your delegation skills, you need constructive feedback. So finding out who is responsible for giving you that feedback, and how often are you going to have professional development reviews? And you may have a written feedback form that you have to fill in with your reviewer. So finding that out when you first start is really helpful. And having a reflective diary. So if you had a shift that was really, you struggled and was challenging, that you write it down, do a little reflection, and then sit down with an experienced nurse to talk it through. And you can use those for your NMC revalidation. We all have days when we feel overwhelmed with our workloads. That includes me, senior nurses. I don't know anyone that has a week that they don't have times when they start to feel pressurised, and that's the nature of health and social care in the NHS with all these vacancies that we have. The thing that gets you through is teamwork. Prioritising and delegation are interrelated. So having good teamwork and support is essential for you to develop your delegation and your skills to prioritise and manage your time. So I have a video on how to choose your first post that gives you lots of tips to make sure that you check on the support that you are going to be offered for your first post, and you will get a feel for a team. If team communication breaks down and there may be clashes in a team, it may impact on safety and standards of care. Now, I'm not saying on one-off on a day where it gets extremely stressful, where emotions are running high, but that you can have teams where there's negativity and there's toxic team cultures, and that will affect team working and delegation. And if you ever feel uncomfortable at the way someone's spoken to you or the way that the team is working, access support from your manager or go above. There'll be a managerial team of support. If you don't feel comfortable due to the issue being linked to a manager, for example, then speak to a HR human resources advisor or NHS Freedom to Speak Up guardian. And I will do a future talk on incivility and dealing with issues in a team in a future talk, because I know quite a lot of students and newly registered nurses have asked for that. So to be able to delegate tasks and interventions, you need to prioritise your patient's needs and have an overview of your caseload. And a tip that a sister gave me, an old school sister many years ago on a neuroscience ward, go around and visit every single patient at the start of your shift to introduce yourself, and you can assess and prioritise their needs and preferences, so using open communication. In my speciality, which is neuroscience, that's especially important because some of the patients would wander and we wouldn't always have the locks on the doors that we have nowadays. So it's really important to have a visual so you know what your patient looks like. But it's really important to developing a therapeutic relationship, and I would always go at the end of the shift and say goodbye to the patients, and reviewing handover, patient care plans and case notes, really important to prioritise, and identifying immediate urgent priorities versus non-essential and non-urgent at the start of your shift. So you need to initially prioritise for you to know what you need to delegate, and you're initially looking at urgent, what needs to be done urgent, where is there a risk to the patient or a safety issue, it has to be addressed now. It may be that the patient's in severe pain or psychological distress and you need to go to that patient straight away. You've also got non-urgent but essential, so it needs to be completed that day. So it could be that a patient, for example, has got an infected wound, it's oozing, patient has cellulitis, a risk of gangrene of the leg, and it's been prescribed that that dressing has to be redressed every day and assessed for its size and swabbed. And so although it's non-urgent, it's essential that it is completed on that shift. You could have non-urgent that isn't essential. So it's not essential to take a patient in a wheelchair to the shops to get a newspaper. However, your priorities may change according to the needs of the patient. You're using a person-centered approach. So a non-urgent may become essential if you're developing a therapeutic relationship with the patient. And you need to taking them to the shops and developing that relationship enables them that they'll take their medication, their prescribed medication, and you're developing and able to educate them for them to trust you, then it may become essential. So it's just to be aware of that. And then once you've looked at prioritising, you can then think, well, what can I delegate to a health and social care support worker? Can I get a patient to a support worker to sit with someone one-to-one, which is a priority because someone's mental health is deteriorated, or does it need a registered professional? And that's where you're utilising your supervisors and experienced nurses experience to help you with those decisions. So using a systematic approach helps, using A, B, C, D, E, or you might have to do conduct a mental capacity assessment urgently. Some nurses and nursing associates will use their own methods. They'll use ordered lists and tick boxes. Sometimes using EPR prompts and alerts helps, and some nurse managers don't like nurses to have lots of written tick boxes. They prefer you to use EPR prompts. So finding out how, what other nurses do, what their preferences are, but you will also develop your own methods as well as you become more experienced. Safety checks of things that need to be done urgently. Is the patient unsafe, about to fall out of bed? Are they displaying signs of anxiety, depression, suicidal thoughts? Do they need post-operative observations, doing quarter hourly, half hourly? What's the national standard? Is the patient cyanosed or choking? So obviously these need to be addressed immediately. Do they need one-to-one observations? Are they in pain or psychological distress? It's also helpful to use a mnemonic sometimes, and I've got an example here, the 5 R's Rights of Delegation from Zerwekh. I don't know if that's how you pronounce it, et al., 1997. And as I said, there's other mnemonics out there, but this is one example. The reference is at the end if any of you wanted to look at delegation in your assignments. The right task for the right team member is important, that they adhere to national standards and procedures and deliver that task or intervention correctly. The right circumstances is in place to delegate. For example, looking holistically and at the whole context of the delivery of that intervention. If somebody's going to theatre, you wouldn't delegate the task for them to go down to the shops in a wheelchair, for example, to take a patient down to collect a newspaper. So you need to think of the whole picture. The right person who has the right skills, competence, is in their job description. The right direction and expectation is made clear, that you've given clear direction, simple, clear direction. And it's helpful to say, do you understand what I've delegated to you? Get them to repeat it back. Time parameter may be set. And the right supervision to monitor those interventions. You need to evaluate, did they complete what you delegated them? Is there any feedback from that person on the task or the intervention? It really depends on what you've delegated. I'm struggling to delegate and manage my time. What do I do? So firstly, talk to somebody, and it really helps to keep things in perspective. You may just be having a blip. It may just be that you had a challenging shift. You can offload, sharing your experiences with your line manager, an experienced nurse, a band 5 support group or nursing associate support group, online nursing forums. They're fantastic. You throw a question out and often you'll get somebody that's experienced that themselves with some really good advice. Seek additional help if needed. If you continue to experience this difficulty, you can extend your supernumerary period potentially. You can have one-to-one supervision from an experienced nurse or educator. You might need a performance improvement plan where you have some structured written down reflection and constructive feedback. You might need to access well-being, psychological support, mental health support. It's all individualized to your needs, but please do speak to somebody. I have a structured tool form that you can use in my book, How to Thrive as a Newly Registered Nurse. So this is copyrighted, so you need to put the reference in. And this could be used for a nursing associate as well. So putting the date, the time, and writing down what your needs are. You would put the aim for the feedback on the shift, so it could be developing your time management skills, the skills needed to delegate. It could be whatever aspect of area that you want to develop. You can put down your previous experience, how long you've been registered for example, and the knowledge and skills that you currently have, and just setting the scene for what you need your support, how you need to be supported. And then after the shift, reflecting on what you did well, what needed to be improved, what additional support might help you in your practice, getting whoever is supporting you on that shift, the clinical educator, preceptor, shift supervisor, to give you some feedback on your performance, what you did well, what your strengths were. That's what constructive feedback's about. We all have areas though where we can look at developing and summarising bullet points, areas for development. You might do some joint goal planning there, and some areas to develop in the future, or just write down some plans for the future, and then any additional support and training. So that might be really helpful to have a sort of bit more of a structure to it if you are really struggling. And then there's my references are there, and there's some really good resources on the Royal College of Nursing website linked to accountability and delegation, and the Nursing and Midwifery Council website, Delegation, Caring with Confidence, the Code of Action. So I really hope that helped, that talk. Do DM me on Twitter, my website or Instagram, put comments in the YouTube comments box. If you've got any questions, I'll answer them all. And I really hope it's helped, and do check out my other videos if you think they might help on my free YouTube channel. Good luck in your future career and roles.